Kia ora koutou katoa. Good afternoon, everyone. First today, I'll hand over to Dr. Caroline McElnay for the latest update before making an announcement on vaccination certificates. Then I'll hand over to Shane Hunter, the Deputy Director General of Data and Digital at the Ministry of Health, and Michael Dreyer, the General Manager of National Digital Services, to run through how the vaccine certificates will work, which is why we have the screen here with us today. But first, Dr. McElnay.
Thank you, Prime Minister, and kia ora koutou katoa. We have a detailed 1 o'clock statement today, so I'll keep my update on today's cases short. There are 24 new community cases today. 18 of these cases are in the Auckland region and 6 are in the Waikato, with 3 of the latter cases being formally reported today. They were made public yesterday. There are also 2 cases to report in recent returnees in our managed isolation facilities. Of today's 24 cases, 7 are yet to be linked to a current case, but interviews are ongoing. And for yesterday's cases, there are 8 cases that remain unlinked at this point, and again, investigations continue. However, I do want to say that all of the Waikato cases are linked. There remain 12 active subclusters where there have been recent cases, and these are the focus of our public health response. Looking ahead, we estimate from the number of already notified cases and their contacts, we would expect an additional 48 cases to come through in the coming days amongst those contacts. The 2 best tools we have in the continued fight against COVID-19 are testing and vaccinations, and the numbers for both continue to be steady. Yesterday, 14,905 tests were processed nationwide, 12,595 swabs were taken in Auckland, with more than 84,000 swabs taken across Tamaki Makaurau in the past 7 days. There are 22 community testing centres open across Auckland today, and in Waikato, additional testing capacity has been stood up at the testing sites around the region, and teams there continue to see high demand. So testing is underway across Hamilton sites, and pop-up sites are continuing at Raglan and Huntly. Testing locations nationwide can be found at healthpoint.co.nz. And just a little bit more about Waikato. Waikato District Health Board has not identified any locations of interest of significance in Hamilton City at this stage. All potential exposure events have had direct interactions between individuals, and they have been followed up directly. However, as the Waikato continues to undertake their investigations with the new cases reported, there may be additional locations of interest, and they will be added to the Ministry of Health's website as they come through. The DHB has informed us that indications so far is that prior to receiving positive tests, the households affected have been following guidance about mask wearing and social distancing. And just lastly, today marks 7 weeks since our first case of COVID-19 associated with this outbreak in the community, and when New Zealand moved to heightened alert levels. I'd just like to thank New Zealanders for their efforts during these challenging times. But we do ask that everyone keeps up good habits that have helped us deal with cases of COVID-19 and has got us to where we are today. That includes getting tested, staying home as much as possible, wearing face coverings, and keeping track of where you've been. We know from experience overseas that COVID-19 is becoming a disease of the unvaccinated. So please, book yourself in today at bookmyvaccine.co.nz if you haven't already had your vaccine. Thank you. Back to you, Prime Minister.
Thank you, Dr. McElnay. Yesterday, Cabinet decided to keep Auckland at alert level 3. I know many people were hoping to move down to level 2, but the number of cases and our level of vaccinations are not in a place where we can do that safely. Instead, we shared what a phased step down from restrictions will look like, beginning with what the public health experts advise us are the safest measures: meeting outside with one other household up to a maximum of 10 people, allowing outdoor recreation, and resuming early childhood education, again with infection control measures that include maintaining bubbles of no more than 10 children. These measures are aimed at carefully and safely relieving some pressure on Aucklanders to make level 3 just a little bit more bearable while we keep fighting hard to contain Delta and get our vaccinations rate up as high as possible. Even with these changes, Auckland will continue to have amongst the toughest restrictions of anywhere in the world. I know that's hard work, but it is hard work that has literally saved lives while we have vaccinated hundreds of thousands of people. Now we just need to keep going. As we've said from the start, the vaccine is a ticket to freedom. It is the most effective tool we have to lower restrictions and bring back some of the things that we have missed. We can already see how the vaccine is protecting people in this outbreak. Delta is literally bypassing vaccinated people and latching on to the unvaccinated. A recent case highlights this. We had an individual who was unvaccinated in their household. Not one of their family members who were vaccinated got COVID. Only 3% of cases in this outbreak have been vaccinated, and modelling suggests that the vaccine has reduced infections by around half of what they could have been. So the evidence is clear. The vaccine works and is safe. From conversations we've had with a range of providers across different DHBs, those who are working with iwi, Pacifica, our young people, you hear the reasons why people may be reluctant or are taking a bit more time. Some are waiting to see the long-term health impacts. Some have questions they just haven't found a trusted person to ask. Some do not believe COVID will ever affect them, and it's not important enough. I want everyone to be able to satisfy themselves that the vaccine is safe, but I want them to do that now, because the impact of waiting is just too great. Waiting puts people at risk. It also makes it harder for those parts of our lives that during COVID have been considered higher risk to come back to life. To overcome this issue and to make these events safer, many countries have used something that is often referred to as a vaccine pass or a vaccine certificate. Simply put, it's proof that you are fully vaccinated and that you are therefore pose less risk to the people around you, and that an event you attend is less likely to become the source or the site of a large super spreader event. These are now common overseas, and they make good sense. That's why Cabinet has agreed to the use of vaccine certificates in New Zealand as a way to help give more certainty and ensure greater safety of high-risk events and venues. The question that everyone will rightly have is how widely will these be applied? That is work that ministers and agencies are currently undertaking and will form the basis of a new framework for us to use as a nation once we have higher vaccination rates. We're consulting on this framework now, and I'll share more detail in the coming weeks. Here are a few points I can share now. We will use them as a tool to lessen the risk in what are currently considered high-risk settings, including large-scale events. We are also consulting on their use in places like hospitality. There are areas we will not apply them so that people are not restricted from accessing things like essential health services or, for instance, food from the supermarket. The certificate will take the form of a physical document that you can download and print or carry in digital form on your phone. And finally, we'll release the detail of the framework in advance of it taking effect, so people will have time to prepare. But indicatively, we're likely to begin using them in November. These points form the draft framework we're now consulting on. But while we finalise details on where the certificates will be used, Cabinet has agreed we will be using them. It's one of the best ways we can assure that summer plans can go ahead uninterrupted. It will help us to keep people safe, and it will help the industry with as much certainty as possible. And so here comes my ask. Please get vaccinated now. Summer is close, and so to be fully vaccinated and fully protected and enjoy the things you love, you need to be vaccinated this month, not in December. I encourage you to talk to your doctor or someone you know who has had their vaccination. It is okay to seek advice, and vaccine centres are incredibly welcoming, informative places, and there are nurses and health professionals there who can answer your questions. The best Christmas present to your family this year is to bring forward your vaccination immediately.